To the fourth and final of running form faults that can cause low back pain. The collapser. How could we forget about the collapser? So first, what should it look like? That's the correct on the left. That's the collapsing on the right. Can you see it? Sometimes what I like to think about is if I make a rectangle, if I box out my torso between my shoulders and my hips, what does it look like? Does it look symmetrical? If I were to push straight down, is it going to collapse? Is it going to be solid? If you think about it that way, when we land, the forces are going up. We've still got the forces of gravity going down. If we have a structure that's stable, it should be able to withstand forces downwards or upwards. Another way to look at it is this. Imagine like we've got a Jenga tower is your spine or your torso. If we've got this presentation, this side bending or this collapsing towards the right, if I push straight down, what's going to happen? That's not going to happen to your spine, I promise. But you get the point. Lots of stress on the back. Versus here, I can push a lot of force straight down or up. It's more up with running, but you get the point. So we want to make sure we've got that stable structure of your spine in addition to the core that surrounds it. So some other tips to see this, to be able to visualize this collapsing is, what we'll see is the elbows won't be even. We'll see there'll be one be higher than the other. Here I'm collapsing towards the left. If you could see with less exposure there, my left shoulder is also lower than my right. Other signs is sometimes I'll draw a line down the middle. I'll take a piece of paper and see, what does it look like? Do I have equal symmetry on both sides of my body? Here you can even see I've got that curve towards the left, apex towards the right. What does it look like in real time? You will see this from the back view. This is where we pick up on frontal plane or transverse plane movements, rotation or side bending. Can you see it? What we'll do is we'll pause at what's called mid stance. I'm at my lowest point. Legs, thighs are equal, arms are equal. In this position, we shouldn't see this collapsing at any point throughout the gait cycle, but it's easiest to see here. Mid stance left, same story on the right. If you're collapsing on either left or right, that still gives you insight of which side may be the weakness, but it's something to work on and something to address. So thanks for participating in the quiz. I'm going to keep doing the quiz because I think it's a good way to keep involving you guys, because I want to involve you guys. I don't want to just sit here and talk to myself. I'm not that interesting. So the question was, what muscle primarily can cause this? Before even knowing what all the muscles are, there's one way I want you to think about this. If you're a clinician, you are going to understand this a little bit more. I want you to start thinking this way. 3 planes of movement. Again, forward and back, sagittal. Side to side, frontal. Rotation is transverse. This fault is in the frontal plane. Which muscles primarily act in the frontal plane? That alone, you can narrow it down to that glute med, the queen herself. Look back, if you're new to the series, welcome. We talk about the queen glute med a lot around here. She is a diva. High maintenance, but she's important. So we got to give her what she wants. Let's pull out the high-tech model that I have here to represent what the role of the glute med and keeping that pelvis stable. So this obviously is your pelvis, looks like it. These are your legs, gorgeous. Can you imagine what happens is if I take one of those legs away, don't worry, it's still there. Now, in order to prevent this scenario, the pelvis from dropping, what can do that? What needs to do that? The glute med on the side. To prevent this pelvic drop scenario, 2 main muscle groups, and our treatment for this, our fix for this, is going to involve them. One is obviously the glute med. That's at the hip, the lower body. The other is at your core, and not just your core, your lateral core. Okay, so I'm going to be performing the first exercise in the series. This is actually going to address both the glutes and the lateral core. This is such an important exercise. Think back, what does it look like? The functional runner screen tool for the test. Can you perform 10 of these? Again, making sure it's not sloppy. I'm not doing it just to do it. I'm going to be working primarily the bottom side in the stability roll. Yes, we're going to be working the top side, but nowhere near as much as that bottom side. The modification is to shorten the lever arm, to bend the knees. Pad your knee, please. It doesn't feel great on the outside of your knee. And I'm again keeping this level and straight and just lifting that top one up and down, challenging the lateral stability of your body. And of course, the other side as well. So if you've been following me for a while, even a short amount of time, you know this is one of my favorite exercises. It is the most tailored to running. It's tailored to how we use this muscle, and we're mimicking it. Clamshells, we don't do that movement when we run. We do this thousands of times when you run. So I'm not going to go into crazy detail. See the previous post where I break this down. So this is what I consider static stability. That glute is working, but I'm not moving. Running is dynamic stability. So the progression from there is farmer's walks. So you'll notice here I'm holding a weight, maybe 5 pounds in the beginning. If you don't have weights, because they're crazy expensive right now and they're hard to find, use a grocery bag. Grocery bag filled with cans of soup, maybe 5 cans. And what you're doing is you're walking, trying not to give in to that force. It's going to try to pull you. It's going to try to collapse you. Don't let it happen. This is what I'm always thinking about. Whether it's a cue for runners that are doing this, when you're doing all these exercises, this is very important. Remember the symmetry rectangle? If I have headlights coming on my shoulders, the front of my hips, my goal is to at all times keep that symmetrical. Think back, what does this look like? Think of the Jenga tower. I want to be able to withstand forces. If I push straight down, if I push up, I want that to be stable. If I'm dropping or collapsing, the headlight, the shape is going to look like over there. That is not a stable surface. So that concludes the 4 running form faults. Don't worry, there's still a lot left in this series. I've got a lot of stuff planned. A little side snippet on posture coming your way, a little bit of something for everybody. So hope you guys enjoyed this. If you guys have any questions, please let me know.